Thank you, sir. My honor to be in your IC. So thank you for having me. So I'll be talking about, I would take about 8 minutes, maybe half a minute longer. So I'll be talking about Twitter, Instagram, YouTube, and blogs. So I'll try and cover them as quickly as I can. To begin with, what is so unique about Twitter? So Twitter is what is called a micro blogging platform. So you can post with characters up to 280 characters long. You can have posts which are up to 280 characters long. The users who are on Twitter are usually quite passionate, are extremely well informed, and there's a lot of discussion and a lot of debate that happens on various issues on Twitter. So, and here people let loose, they talk to strangers, they engage with personalities from all walks of life because the default setting here is public. So you really can reply to anybody, retweet anybody's post, and so you can engage with celebrities. They often engage with you back. So that's the kind of ecosystem that Twitter is. So how can ophthalmologists make the most of it? These are some really nice profiles that I found. So you need to have a good picture, a nice cover image, something that talks about your practice, and a link to your website. So these kinds of profiles are really good to have on Twitter. When you post content on Twitter, the important thing about Twitter is that your content needs to be unique, because only then you're going to get any engagement happening. Try and use images, use links if you can, and very, very important to use relevant hashtags on Twitter, because who knows, if you have good content and good hashtags, you could be trending on Twitter. So that's important. Try and avoid giving any clinical advice on Twitter or any other social media for that matter. What is also important is to not just tweet what you are thinking, but also to try and listen and see what others are talking about. And you can always retweet and reply to people, tag people who are related to what you are talking about. So that engagement has to come from both sides, from you to them, for them to have engagement towards your post. So that becomes important on Twitter. What is also very, very interesting with Twitter is, you have all these organizations giving extremely witty responses. So if Mumbai Police or Delhi Metro Rail Corporation can be known for their witty replies, then why can't we ophthalmologists do it? So that's what trends on Twitter, and that's what catches the eye of people. So moving on to Instagram. Instagram is all about visual appeal. You need to have interesting pictures, videos, colorful posts. So that's what Instagram is about. People here are quite different from Twitter. People here are usually much younger. It's a much younger audience. They're more creative, looking for fun, looking to see what their loved ones are up to. And there are a lot of entertaining content creators who post on Instagram. So here again, if you do intend to post as a professional, it's good to switch to a professional account. This is my personal. So if I would want to use it for professional reasons, I would want to switch to a professional account here. Again, fill out your practice information, have a little bit about what your core areas of specialization are. And I mean, some of you might know this is really ophthalmologists' new playground now. There are so many ophthalmologists who are on Instagram, who post interesting content, have a good number of followers, and get a lot of views. So we use it for our aesthetics page. You can use it to demonstrate post-operative results with permission from the patient, of course, because these are visual things. You can see and appreciate the changes that happen. So this is something that can be posted on Instagram. A lot of people post patient feedbacks. That's Dr. Advait, Dr. Nishant, one from our center. So these are again visually appealing. You have a picture with the patient, and you can use it to create awareness. So so Dr. Aarti talking about how cataract surgery is a lot more complicated than the patient thinks. Dr. Karishma talking about the symptoms of keratoconus. And so everything is very visually appealing. You have interesting headings, So this is the kind of content that works on Instagram. Moving on to YouTube. So YouTube is all about the enormous appeal that videos have, that you can't have with text or with images. What is also important about YouTube is that it's also the second most commonly used search engine. So when you search for something on Google, you also see a lot of videos on the first page of Google. So that's why this is also very, very important for you to be found on a Google search. And users here are quite personally involved. They comment a lot. You can also get a downvote for your vote. This is probably the only platform where people can dislike what you post. And because they see you as a person, there's more give and take involved in YouTube. So I'll be showing examples of what we do. So here again, you should have a nice cover for your channel. talk a little bit about yourself without boasting or anything of that sort. And then try and have some different playlists where you're trying to talk about what those videos contain. So there are some videos for patient education. There are some videos which are academic or surgical videos. So it's good to have them segregated and differentiated. You don't want a patient seeing a tarsal fracture video because the patient might not appreciate that too much. So you can put out patient educational content because that again increases your visibility, and it helps the patient as well. They would want to know more about common conditions. As we know, in YouTube there are a lot of our peers as well. We do look at surgical videos, something new that we are doing. So sharing that is also a good idea on YouTube, because first of all, you are educating people. Second, you are kind of demonstrating what you're doing. So that is also something that can be done on YouTube, and this is ideal for YouTube. If you have any profile videos, whether it's professionally shot or if you've done it yourself, just need some good editing, that also just adds a little bit of professionalism to your YouTube profile. And when patients see it, it does improve your perception a little bit. So moving on to blogs, it's important to promote balanced and educational content again on blogs. It's important not to talk about ourselves, not to talk about, you, but more to talk about things that patients might want to know about. Indirectly, you do end up promoting yourself, but should not be done directly at all. And if you can get a domain name, that is quite useful. I mean, you don't have to call it a blog. You can call it patient awareness, or you can call it press and media coverage if it's been covered in newspapers or media articles. And it's quite reasonable to get a website domain, and you can design it yourself. I mean, you don't need to professionally do it. It's quite easy now. You can just do it yourself, put a little bit of patient testimonials, and then again make it more about education, more about topic related. And then again, it's important to have some connects with electronic press media. People don't read physical newspapers too much anymore, but everybody does see these articles on the digital media, on the digital platform. So when somebody does look for, say, dry eyes, and there's a news article where you're talking about it, even if it's a blog that you shared with the news article website, then it does increase your visibility and does increase your credibility as well. So that is also something that can be done. And the other things to work on is, even if you have a blog or you have your own say your institute or your center website, it's important to do some search engine optimization. This is not something that is easy to do yourself because it takes a lot of time. So ideally have somebody professional to do search engine optimization. Local search engine optimization is when somebody, say, types something like best eye clinic in Delhi or best eye clinic near me, and they find you on the Google map listings. The usual search engine optimization is them finding you on the first page of Google. So if you're putting out content, it's also important that people find you. And for that, you need to have search engine optimization. And that is important for YouTube as well. So get that done professionally so that you have relevant keywords that are available when people are looking for you. So just to summarize, Twitter involves a more engaging, a more aware audience. There are important issues that are discussed there. And you need to post unique content which is within your character limit. Instagram is more of a younger audience, and the visual appeal of the content is extremely important here. Twitter is all about the YouTube is all about the enormous appeal that videos have, and search engine optimization and having the right keywords is important here. For blogs, it's important to put out balanced and educational content. It's important also to have connect with journalists, public relations, etc., so that you have your articles or your blogs out there with good news journals and all of that. So that helps as well. So thank you, and thank you for having me. Thank you.
Thank you.